Hi there, I'm Dr. Chung and welcome to your friendly proctologist. I'm a board certified colon and rectal surgeon or colorectal surgeon or proctologist if you prefer, and I'm based in Orange County, California, which is about an hour south of Los Angeles. If you want to meet with me or consult with me or get a second opinion, I'm available by email. Just email me at yourfriendlyproctologist@gmail.com. I will send you all the details in order to set one up. So I welcome you personally to this space and to this time. Thank you so much for watching this video. If you haven't already, please like and subscribe. Join this community. Let's learn about our bottom end, shall we? And today we're going to talk about drainage, or things that can come out of our bottom end. What is it? What does it mean? And what should I be thinking about? That's what I want to help you with today. So let's get to it. In my opinion and experience, there are 5 major types of drainage, or things that can come out of our bottom end. The first one is watery, and literally someone just poured water on the outside of your anus. And one of the major ones is sweat. I mean, we have sweat glands there, not on the anus, like on the little hole, but around the anus, because we've got hair. If you can't see the hair, well, it's peach fuzz. Trust me, you do have hair down there. And it's trying to cool off. This is normal stuff, okay? Like maybe you were running for a very long time. Maybe you were in your garden, or you're in a hot area, you're working there. Or maybe you just wore really tight leather pants all day long and there was just nowhere for the skin to breathe. So you took your tissue paper, you wiped there, and it just completely soaked the whole thing. But it's just thin, like literally water. Another type of water drainage is diarrhea. Okay? I mean, water does seep out, it finds its way through cracks, and it can make its way outside. It does not mean that you are incontinent. And I'll mention another thing here. We all can have accidents with diarrhea. The receptors and nerves down in our anus are not very sophisticated. So sometimes we may think it's actually a ball of gas, but it turned out to be a bunch of liquid poop. We all make it. And guess what? I've done it, I think, like twice in my life so far. Maybe a few more times. It's happened. And you make a judgment error because honestly, you don't have very good information from our intel in our anus. And so you get splat in your underwear. I mean, literally, like the last time I remember that happened, I was in fellowship training and I was sick. I was dealing with an illness and I thought I had to fart. But guess what came out instead? Yeah, I filled my underwear like a garbage bag with poop. And I know that it sucks that it happened. Thank God I was at home at that point, but it's not something that I know I'm not incontinent. Okay, so let that be something of comfort to you. But yes, the water can seep out. Now, how do you know if it's sweat or diarrhea? Well, you can smell the odor of it. If it's very, very smelly, like you literally like have a piece of poop on your tissue paper, that's gonna be diarrhea because it came from your intestinal tract. It is jam-packed full of poop bacteria. There are so many times when our anus is giving us issues like going through a flare-up or having these drainages coming out of our bottom end, that it's awesome to have an option like Pranicura at our side. These guys have been an excellent sponsor of this channel, and they have been doing so for more than a year. This is my personal supply. Let me show you that inside. The texture of this cream is nice and fluffy. It's very pleasant to put on, and it's got that menthol type of smell. And what kind of stuff are we using it for? We're talking about pruritus, itching. We're talking about internal hemorrhoids. We're talking about external hemorrhoids. We're talking about anal fissures, anal pain, anal spasm as well. And the spasm, yeah, it might surprise you, but that cool menthol actually can distract people from the pain. And that's what I find to be truly amazing, is we're still finding uses for this thing even today. You can only get this at www.pranicura.com. It contains only natural ingredients. Go check them out and order your jar today and take the 30-day Pranicura challenge. Number 2 type of drainage is poop, stool, whatever you want to call it, right? Obviously, we know there's lots of textures and shapes of the poop, but there's also a lot of colors with it as well. And lots of people get super analytical and nerdy about the poop because it tells us about the health of our digestive system. What is it doing? What is it not doing? And I'm a surgeon. Unfortunately, I'm not specialized enough or have the training or research into that much detail into poop, like colors and stuff like that. I'm more interested in whether you have blood in it or not, to be honest with you. And of course, I want you to have soft texture stool. I don't want you to have diarrhea or hard stool. But one thing that could be confusing is when you have very, very dark, it even looks black. And black stools is not a good thing according to the internet. They all say it's probably blood, you have cancer, you should go see a doctor, otherwise, you're going to die. But they don't tell you that sometimes dark green poop looks black in the toilet bowl. Maybe the lighting in your bathroom isn't the greatest, and so you couldn't tell if it was a dark maroon. So what's the best way to do it? In my opinion, grab a sample of that poop. Grab a little, disposable frozen yogurt ice cream spoon. Grab a scoop of it. Take it outside where a place you don't care if it gets dirty and good ventilation. Smear it on a piece of paper and spread it thin. When it spreads out super thin, you're going to start to see more of what the color is composed of. If it's not good enough, then take a drop of water and actually sprinkle it onto that smeared poop, and I guarantee that color is going to come out. And you might be surprised that dark black poop was actually dark green or really, really dark brown. It's not blood. It's not maroon colored. And if it is maroon colored, or maybe you're on an iron supplement, that can also cause black poop. But if it turns out to be red, you want to get that evaluated, honestly. Now, do you have to go running to the doctor in an emergency? In my opinion, no. If you think it's your hemorrhoids that caused the issue, like you just had a really hard dookie, then maybe you can try some different things, like soften things up, maybe change your diet a little bit, maybe stay away from those pizzas that make things upset. And then if things improve, well, then it probably was your answer. You can keep track of it from there. Because when you go to the doctor, there's a lot of doctors who will jump at the chance to give you a colonoscopy. And I'm not a fan of giving everybody a colonoscopy just because you said you had a speck of blood come out in the tissue paper, okay? Because again, colon cancer is nowhere near as common as hemorrhoids or anal fissures. And everyone's gonna have a hemorrhoid issue at some point. So in the end, the answer to that question, whether you should have colonoscopy, is have that discussion with the doctor. Ask your questions. Make sure there's a follow-up plan if you decide not to do the colonoscopy. What are your options? It's not like no one's going to put a gun to your head and tell you that you've got to do a colonoscopy. It's a decision, and it should be one that is cognitive, where you understand what the picture is, what your risks are, and how will this test be helpful to understand your body and your condition. Drainage number 2 is leading to drainage number 3, and that is blood. And blood has got a nice color spectrum from bright red all the way to dark maroon or black, and also texture. So dripping liquid blood to congealed jelly or coagulated blood, because blood clots. And the most common blood that we see in anal conditions is bright red, right? That's nearly almost always going to be the case. Where you're going to see if painted on the outside of your stool like a small streak, or you'll see it on your tissue paper. And that's going to be hemorrhoids and anal fissure, by far the most common. So when you see that, you can probably say, you know what, I just had a hard poop. It makes sense. I'm going to try and get over this hemorrhoid flare, this injury, by adjusting some of my habits. I know I had that pizza and I should have taken a stool softener with it, right? Other things like dark black blood usually signify something from the stomach or bleeding from somewhere else. But I think not just that in itself is the worrying thing. I think that when the blood is swirled into your poop, or it's like kneaded in, like you had some food coloring dye in your dough and you're like mixing it up and the poop is coming out that way, that's more concerning to me than just the color itself. What's another example is because let's say you had old blood sitting in your rectum, that's from a bleeding hemorrhoid. You know, it was your anus is here, the hemorrhoid from on very tippy top started bleeding and pooling inside of your intestine on top. It didn't leak out through your anus into your tissue paper, but it was bleeding up here. So while it's sitting there and it gets old, it turns to a very dark black color. Okay. And so that could also be a possibility. So it's something that requires some observation, some follow-up. But definitely I wouldn't blame anybody for wanting to do like scopes up through the mouth or through a colonoscopy to evaluate that further. Because yeah, I would agree. That's something I would be concerned about as well, and I would want to know about it. The different textures, if you have a lot of blood at once, it's going to pool and it's going to maybe even form a blood clot. Obviously, we don't want to lose a lot of blood because that can make us anemic or make us feel faint and lightheaded. That comes in many shapes and forms and different contexts depending on the condition and what exactly is bleeding in your intestinal digestive system. Because honestly, a lot of blood can come from your nose and drip down into your stomach, your mouth, your lips, and you swallow the blood, right? All the way down from your intestines, your stomach, your anus. And it deserves careful listen to your story, then determining what steps are needed to investigate it, and a discussion as to why is it necessary, why is this going to be helpful, and why they're suspicious of something not right inside the picture that you're presenting seems to be more worrisome. So we should do something about it. Again, big thoughtful discussion is what I believe needs to happen there. Drainage number 4 is pus. And pus is that thick liquid that your immune system produces. There's a lot of junk in pus, which is why it's so thick and you can't see through it. And some of the components, there are alive and dead immune cells. It's sloughing of the lining of the wound. It's just garbage, that's waste products that's being produced. It is also scar tissue material, the building blocks for healing the wound. And of course it also contains bacteria and other whatever particulate matter is around there. And since we're talking about the anus, poop, right? And it comes in many different colors. I think that pus in the natural state is more whitish, but when it mixes with your poop, that's when you start to get the yellow, the greens, the browns, okay? And pus is not always bad. Of course, pus is always there when you have an abscess or infection, and we want to get that drained out. We don't want it to stay locked in the body. So if you feel like you have an infection because you got pain or you got some drainage coming out, definitely be seen by a specialist. But pus is not always bad. Like I said, sometimes you're healing an anal fissure and there's no locked in infection. The wound is creating garbage and also has waste product, and your immune system is there and is a sign of a healthy healing wound. Or another example, you just had a fistulotomy for your anal fistula surgery and there's no locked in infection. It's just a big wound that produces a lot of this liquid. And that's a-okay. In fact, it tells me what the progress of the wound is, because eventually the wound should be healing and the pus should be getting less and less. So when it's getting time towards the finish line where I expect you to be healing, yet you're still making this pus or drainage, that's when I'm suspicious something is not quite right, and an investigation needs to be done here to make sure I get out all the infection, or I make sure I heal the entire wound and treat that accordingly. So it's not always a bad thing to get rid of, but in my opinion, it's a very important tool to use to help me figure out how to help you and discover if there's a problem. Number 5 is mucus. What a terrible word, but I think it encapsulates it so well, doesn't it? And mucus is different from watery because it's thicker, it's more jelly-like, right? It's not as thin as water. And it's also different from pus because mucus, you can usually see through it. It's kind of a more clear type of liquid. And you might see this stuff inside your poop when you look in the toilet bowl because it looks like there's a jellyfish that's swimming around your poop. Yeah, I mean, it's kind of weird looking, but you might see this outline where this jelly is. It looks clearly different from water. Mucus has a lot of different sources, but definitely the intestinal system, the entire system creates this mucus. It's to keep it hydrated, protect it from chemicals, from pH balancing. I mean, in the anus, it's really important to have this mucus, which we know that there's glands inside of our anus that can get infected, create abscesses, but this mucus is very important for the hemorrhoids to stay lubricated, stay protected. And when you have a hemorrhoid flare, you're going to see more mucus. There's no doubt about it. You're going to see it on your tissue paper. Okay. If you use a bidet, you're not going to see it because it's going to be washed away. So sometimes there is a benefit to using toilet paper. Okay. But you're going to see that on there and be like, oh, when you have the pain and the irritation from the hemorrhoids, it's going to make sense. Yeah, I know that that's supposed to be there. And that's completely normal. When the hemorrhoid flare heals over time, that drain should get less and less, and that's the normal story. When it does not seem to be getting better, that's definitely time to see a specialist for sure. Mucus also has different sources from above the anus, like I said, and when the doctor looks at your anus and everything looks healthy and calm, yet you're still having mucus, definitely then for sure colonoscopy is a good idea. Why? Because they can look and see if there's inflammation in your intestine. They can just see it and actually find signs of it. They can also take biopsies, take pieces of the inside lining of your colon, send it to another doctor called a pathologist who can examine it, see if your immune system is present, trying to react to something. And that's very important information. And then it also has a treatment as well. Mucus also has another possibility, which is like Crohn's disease. Okay, these inflammatory bowel conditions, which again is an overproduction of this mucus because there's a lot of inflammation there. Same thing like the hemorrhoids. The intestines are trying to protect themselves. And so again, if it doesn't get better with usual diet habit changes from your anus, definitely get checked out so we can have a meaningful discussion. They may suspect something like Crohn's, and you want to be able to get treated for that as well. So these types of drainage are not mutually exclusive. You can have a combination of two of them, 3. And actually, yes, you can have a combination of all 5. Okay, like for example, it's a hot, sweaty day, so you got the watery stuff. You've got some hemorrhoid flares going on, so when you poop, you get the blood, you get the mucus, and you also unfortunately have a fissure as well. So there's some pus from the drainage that's happening. And what am I missing? Oh, the poop. Yeah, because your poop is very soft, so it's very difficult to wipe, so it's mixed in there. So 5 out of 5, it's very, very possible and very normal to have that. But when you have all 5, you can kind of try and put the story together and wait as things heal to see what exactly was the issue. How best can I, treat myself and set up my routine to prevent one of these incidents in the future. And so I hope that was super helpful for you, because what I want you to be able to do is have a thoughtful discussion with your doctor. I want you to be mentally prepared with questions, because the doctor's going to look at your anus and tell you, sir, ma'am, you have an anal fissure. And you're going to be like, oh, of course I do. I see the blood, I see some pus drainage, and I have a little bit of mucus. Probably my hemorrhoids are flared up too. And that's exactly what the understanding I want you to have, so that you can understand how the treatment's going to help you to get yourself better faster. And I hope again that you have a great holiday. Do check out our sponsor of this channel, which is Pranicura. You can only get this once again at pranicura.com. Use this for anything going out your bottom end, but specifically, definitely for itching, hemorrhoids, fissures, anal pain, anal irritation. You got it. It is super good for so many things. Definitely, you could even try it before preparation age, but this is meant to be an excellent option. It's helped so many thousands of people. I encourage you to check it out. www.pranicura.com. And thank you so much. Bye-bye.